Gastroparesis is an gastrointestinal disorder. Look at this picture, shows that normal stomach and gastroparesis stomach. Look at this. Then electrogastrography to measure electrical impulses in stomach. X-ray abdomen, CT scan. Look at this findings. Then MRI findings. Look at the stomach. A detail going on. Introduction. Gastroparesis is a chronic disorder that affects gastric motility, leading to delayed emptying of food from the stomach without any mechanical obstruction. It is commonly associated with diabetes but can also occur due to various other conditions affecting the patient's nutritional status and quality of life. Definition. Gastroparesis is defined as a disorder in which there is delayed gastric emptying due to impaired stomach motility in the absence of a mechanical obstruction. It results in symptoms like nausea, vomiting, bloating, and early satiety. Etymology. The term gastroparesis is derived from the Greek word gastro meaning stomach and paresis meaning partial paralysis or weakness. It refers to the partial paralysis of the stomach muscles leading to delayed gastric emptying. Types. 1. Idiopathic gastroparesis. Unknown causes. Most common type. 2. Diabetic gastroparesis caused by nerve damage from diabetes. 3. Post-surgical gastroparesis occur after surgery that affects the vagus nerve. 4. Neurological gastroparesis caused by conditions like Parkinson's disease and multiple sclerosis. 5. Drug-induced gastroparesis caused by medications such as opioids, antidepressants, and calcium channel blockers. Causes. 1. Diabetes mellitus, most common cause. 2. Vagus nerve damage due to surgery or trauma. 3. Neurological disorders, Parkinson's disease, multiple sclerosis. 5. Autoimmune diseases, scleroderma, lupus. 5. Post viral infections. 6. Hypothyroidism. 7. Medications, opioids, anticholinergics, antidepressants. Risk factors. 1. People with diabetes type 1 or type 2. 2. Those undergoing abdominal surgery affecting the vagus nerve. 3. Individuals with neurological disorders. 4. Patients with autoimmune conditions. 5. Those taking certain medications. 6. People with hypothyroidism. Complications. 1. Malnutrition and weight loss due to poor digestion. 2. Severe dehydration from repeated vomiting. 3. Blood sugar fluctuations, especially in diabetes. 4. BCR formation, solid mass of undiagnosed food in the stomach. 5. Bacterial overgrowth in the stomach. 6. Mental health issues such as depression and anxiety. Pathophysiology. Gastroparesis is results from dysfunction of the vagus nerve, which controls stomach contractions. The impaired nerve function leads to reduced stomach motility, delayed gastric emptying, and abnormal contractions of the stomach muscles. As a result, food stays in the stomach longer, causing symptoms like bloating, nausea, and vomiting. Pathophysiology of gastroparesis, step-by-step process. 1. Vagus nerve dysfunction. The vagus nerve controls stomach motility by coordinating peristalsis, wave-like muscle contractions. Damage to the vagus nerve due to diabetes, surgery, or neurological disorders disturbs this process. 2. Impair gastric motility. The stomach muscles become weak or uncoordinated, reducing the strength and frequency of contractions. This leads to delayed gastric emptying as food remains in the stomach for an extended period. 3. Food retention and delayed emptying. Because the stomach muscles does not contract properly, food is not pushed into the small intestine efficiently. Undiagnosed food accumulates, leads to bloating, nausea, discomfort. 4. Disruption of gastric hormones, and neuromuscular control. Gargling, hunger hormone, and mortlin stimulates gastric motility are affected, worsening gastric stasis. The pleuric sphincter wall between the stomach and small intestine may fail to relax, further delaying emptying. 5. Nutritional deficiencies and complications. Prolonged food retention can lead to malnutrition, dehydration, and electrolyte imbalances. In some cases, BSES, solid mass of undiagnosed food, form causing blockages and increasing the risk of bacterial overgrowth. 6. Impact on blood sugar regulation in diabetes. In diabetic gastroparesis, delayed stomach emptying causes erratic glucose absorption, leading to unpredictable blood sugar levels. This worsens diabetes control, creating a vicious cycle of nerve damage and further gastric motility issues. 7. Chronic symptoms and disease progression. Persistent symptoms like nausea, vomiting, bloating, and early satiety affect the patient's quality of life. If untreated, gastroparesis can lead to severe weight loss, psychological distress, and increased hospitalization rates. Signs and symptoms. Common symptoms of gastroparesis include 1. Nausea and vomiting, 2. Early satiety, feeling of full quickly, 3. Bloating and abdominal pain, 4. Poor appetite and weight loss, 5. Heartburn or acid reflux, 6. Fluctuating blood sugar levels. A diagnosis. A diagnosis of gastroparesis involves 1. Medical history and physical examination, evaluating symptoms and medical conditions. 2. Gastric emptying study, the gold standard test using a radio labeled meal to assess the rate of stomach emptying. 3. Scintigraphy, a nuclear medicine that tests measuring food movement in the stomach. 4. Breath test, a non-invasive method to assess gastric emptying. 5. Endoscopy to rule out mechanical obstruction. 6. Electrogastrography EG measures electrical activity in the stomach. A nursing diagnosis. 1. Imbalanced nutrition less than body requirements related to poor gastric emptying. 2. Risk for deficient fluid volume related to vomiting and reduced intake. 3. Chronic pain related to gastric motility dysfunction. 4. Risk for infection due to delayed gastric emptying leading to bacterial overgrowth. 5. Anxiety related to chronic illness and dietary restrictions. Medical management. 1. Dietary modifications, eating small frequent meals, avoiding high fat and high fiber foods. 2. Medications. A. Prokinetics. Example metocillopramide, domperidone to stimulate stomach emptying. B. Antiemetics. Example ondansetron for nausea and vomiting. C. Acid reducing agents. Example protein pump inhibitors. 3. Gastric electrical stimulation, a device implanted to stimulate stomach contractions. 4. Jejunostomy, feeding tube for severe cases to provide nutrition. Nursing management. 1. Monitor nutritional status and ensure adequate caloric intake. 2. Assess hydration levels and administer IV fluids if needed. 3. Educate patients on dietary changes and symptom management. 4. Encourage glucose control in diabetic patients. 5. Provide emotional support to help cope with chronic illness. Treatment options. 1. Dietary therapy, small, low fat, low fiber meals. 2. Medications, prokinetics and antimetrics. 3. Gastric electrical stimulation for severe cases. 4. Surgical intervention, pyloreoplasty or feeding tube placement. 5. Alternative therapies, acupuncture, ginger supplements. Psychosocial medicine. 1. Patient education, provide information about the condition and self-care strategies. 2. Counseling and support groups to help patients cope with the psychological impact of chronic illness. 3. Cognitive behavioral therapy CBT, managing stress and anxiety. 4. Mindfulness and relaxation techniques, yoga, meditation, and deep breathing. 5. Nutritional counseling, working with a dietitian to ensure a balanced diet. Prevention, while gastroparesis cannot always be prevented, the following steps can reduce the risk. 1. Managing blood sugar level for diabetics. 2. Avoiding certain medications that slow gastric motility. 3. Eating a balanced diet and maintaining a healthy lifestyle. 4. Regular exercise to promote digestion. 5. Early medical intervention if symptoms develop. In conclusion, gastroparesis is a chronic disorder that affects the stomach's ability to empty properly. It can cause significant discomfort, nutritional deficiencies, and complications. Proper diagnosis, medical treatment, dietary modifications, and psychosocial support play a vital role in managing the condition and improving the quality of life for affected individuals. Thank you. Have a nice day.